Okay, we're going to get started. First of all, I want to welcome you to the UBC Learning Circle. Our session today is Rock Your Moccasin Day Off. I'm just kidding. It is the BC Services CareCard up at the Provincial Health Service Authority. You're probably like, what are you thinking? It's on Facebook. Somebody sent me an invitation to National Rock Your Moccasins Off Day today. But our presentation today is on the BC Services CareCard. First of all, I would like to recognize the traditional territory of which our office resides, which is the Squamish territory, respecting the territory which I work every day, and that we're able to bring this presentation to the province, across the province. I'm here at our Hornby Street office, joined by our program assistant, Catherine Berry, and over in the Health Canada office, our technical support, Stephen Prevost. And first of all, my English name is Crystal Morris. My parents of Sartlip have handed on the name to me from the Sanishton Nation, Spechia. My interior Salish name, my mom is from Splatsin, is Malastia. Today, we are joined by video conference to Victoria from the Provincial Health Service Authority by Stephanie Power and Nikki Saban, who will be doing the presentation. And I would also at this time like to thank our person for contact with the Health Services Authority, Michelle Robinson. There was a lot of work in the backgrounds, so thank you for your support and moving this initiative forward and bringing this to light. So Stephanie Power is the Executive Director of Medical Service Branch in the Medical Services and Health Human Resource Division of the Ministry of Health. And Nikki Saban is the Executive Director of Strategic Projects Branch in the Health Sector, Information Management and Information Technology Division of the Ministry of Health. So at this point in time, I'm going to hand the floor over to them, and after their presentation, there will be time for questions, and there will be opportunity for questions to be asked at that point in time. So Stephanie and Nikki, if I could hand the floor over to you, that would be great. And as people come on board, I will be just asking them to mute their microphones. So, or if Stephanie and Nikki, if you hear some other people join us and their microphones are on, if you could just ask them to turn it off. So you're not being muted to the other people when they join our conference, okay? And we do have people on teleconference and as well as on Adobe Connect. So there are a lot of people participating today. So welcome to the UBC Learning Circle. And Stephanie, Nikki, I hand the floor over to you now.
Great, thank you very much, and welcome everybody. We appreciate you all taking time out of your busy days to be here with us, and we also greatly appreciate the work that Crystal and her team have done at the UBC Learning Circle to make this, to facilitate this discussion. We're not quite as exciting as the Rock Your Moccasins presentation you might have watched, but we do think we have some important information to partake on you today, and we're interested to have a dialogue about that. So we're going to turn off the video conference and go to a PowerPoint, and we'll walk you through our presentation.
Let's go into
yeah. So we're here today to talk about the BC Services Card and have a bit of a discussion and dialogue about the changes that are coming in the province. Back in 2013, the government introduced and announced publicly that we were going to move away from the existing CareCard that's in circulation today and move towards a new BC Services Card. One of the key tenets of this decision and direction was that could we get to mute their telephones, please?
Just go to today's date, isn't it?
You should turn up that volume.
November 2012.
Get people to try and mute their telephones, please.
the power and the content.
Penelcut Health Center, can we get you to mute your Polycom? Can you mute?
How's that? Set to loudspeaker.
Welcome. Can you mute your? There is still somebody else in the background talking.
Okay, that's great. Thank you very much. So, as I was saying, the services card is intended to be able to be combined with your driver's license, and will feature a number of security provisions. And one of the most important things that will begin to
Take a seat. Take a seat.
Take a seat. Maybe from the kitchen.
Can you please make sure that people mute their phones?
Stolo, can you please mute your microphone? We can hear you.
This is going to be one of the most exciting teleconferences ever.
Stolo, the mute button is right here on top of your Polycom.
Keep it on red.
Thank you.
Actually, color.
Thank you, everybody. So let's go to the next slide. So one of the main, there's a number of reasons why government has decided to move towards a different type of CareCard provision, and one of the big pieces is that the identity card you're familiar with hasn't been updated since the late 1980s. And since then, we've had a lot of technological changes and enhancements in card technology that we would wanted to capitalize. And I think also it's really important to note that citizens on a whole in British Columbia really have a higher expectation of how government is going to protect identity security and utilize some of the technologies around to do that. And so this move and transition to a different type of care card is really going to be able to utilize some of those security features and technology pieces that are available now, not just in Canada, but across the world. This services card is actually intended also to provide greater convenience and reduce a lot of misuse of the current care card, and also ensure that the benefits flow to residents that actually are entitled to receive them in British Columbia. And in addition, it will also become one of the foundational pieces for us to be able to online other government services in the future and provide secure access to those services through a combined card. I think it's really important to talk a little bit about the partnership in delivering this service. Prior to this change, the Medical Service Program and CareCard was a program solely delivered by the Ministry of Health. We are not shifting away from any of the health provisions and the attention to medical services through the Ministry of Health, but we are utilizing our ability to work with our partner agencies under the umbrella of the Freedom of Information Protection Act to come together as sort of a joint program or a collaborative program approach in delivery. So we have the Ministry of Citizen Services and Open Government, who is responsible for the identity assurance services, making sure that we hit government standards and that we're utilizing all the security features that we need to. The Insurance Agency of British Columbia, or ICBC, we're going to leverage our existing capital infrastructure across the province through driver's license offices or government agent offices who currently have the infrastructure in place to do identity proofing of citizens, and they do that already for driver's license, so we're leveraging their existing technology and infrastructure for identity proofing. And the Ministry of Health, as I said, will be replacing the CareCard with a new BCServicesCard and utilizing this new services card as the identification for MSP. So since the actual card is going to be launched in early 2013. And at that point, all British Columbians who are eligible between the ages of 19 and 74, those who are eligible for MSP services will be required to re-enroll in the medical services program in a cyclical fashion over the next 5 years. This will be done whenever you would normally renew your driver's license or your BC ID. So For those citizens who currently have a driver's license in British Columbia, you'll be asked to come to the counter to renew your driver's license, and at that point, we'll ask you also to re-enroll in MSP. For those citizens who currently use a BC identification card for their form of identification, the similar process will happen. On the expiry of your identification card, you'll be asked to come to the counter of ICBC and re-enroll in MSP at that point. The reason we're utilizing, there are two reasons that we're utilizing the expiry date of our existing identification. One is that it's a convenient time where we can actually combine the two functions together. And secondarily, it is a natural progression over 5 years that people already have an event they need to take action at during that time frame. And so we're not asking citizens to do anything in addition to what would be a normal cycle. The services card also is going to be a shift for those citizens who currently hold a CareCard. As of January or early 2013, we'll no longer be issuing gold cards to anybody turning to 65. Those who currently have gold CareCards will be able to use them as valid identification until 2018. The relevance of this is to the population who use a gold card as an identification feature to show that you can receive discounts as a senior. The new CareCard that we're producing, the new BC Services Card, does actually have a date right on the card, so we're not actually removing any of the benefits that our senior citizens receive through different programs, whether it be BC Ferries or through various different stakeholders who utilize the gold card as a discount card. Those will still be into effect, but you'll actually be using the date of your card, date of birth on your card as your identification. So we wanted to take a moment to sort of identify what the actual card looks like. What you can see in front of you here is the card which we anticipate most of British Columbians will choose to move forward with. And this is a combined driver's license and CareCard in one. It looks very similar to many driver's licenses that are issued today, but you'll note that it has an expiry date, as a driver's license does, your photograph and signature, a driver's license number and date of birth. And then on the reverse side is where you will see quite clearly the personal health number, which is the same number that is currently printed on your CareCard, is then going to be engraved on the back of this card. It also has access through 3 different channels to allow point of service terminals to use this card as a functionality, one being a mag stripe, the second being a 2D barcode reader, and the third being a contactless chip for identity insurance services. The second slide here is an example of what those who choose not to combine their CareCard or their new services card and their driver's license is what you will receive. It looks again very similar to what we're used to in driver's license, but you'll note on the back of the card it carries the personal health number and it clearly indicates that it is not to be used as a driver's license. The third version of the card is an example of a non-photo card. This card is intended to go to children and to those citizens who are unable to come to a counter and have a photo proofing event. An example of those types of people would be those in residential care home or assisted living who are unable to get to a counter, and as I mentioned, children. So as of early 2013, we are going to begin to make cards available for all those BC residents who are eligible for MSP. The initial groups that we're going to target are newborns and those who are new to the province. So any newborn children will automatically receive a new services card instead of the old CareCard. Those who are coming to become new citizens of British Columbia will be enrolled in the process through a new BC Services Card. And all those people over 19 whose driver's license or BC IDs are expiring will also be invited to come and participate in the new Services Card program. Additionally, the last group that we're targeting in the first phase of this project will be those who are requesting replacement cards. So if you lose your CareCard, you will be reissued a new BC Services Card. At that point, before the issuance, you'd have to come in and get a photo, go through the identity proofing event, and then you would receive a new services card. So for most people in the province, the process for receiving this card is going to be really straightforward and simple. You'll get a notification in the mail, most likely alongside with a notification that your driver's license is expiring or your BC ID is expiring. You'll go to a driver's license office or designated government agent. You'll confirm your residency, that you actually are residing in British Columbia, and present 2 pieces of identification. At that point, you'll have your photo taken.
So is everything okay?
And then you will be issued a services card. So you're probably, many of you asking, what are the benefits of going to this card? I think it's really important, particularly from a health provider point of view. There is significant interest and importance on a clinical perspective to have a photograph on as many cards as we can. It provides one more check for a physician or healthcare provider to ensure they are providing to the right services to the right person. I think for many people, the option to combine your driver's license and your CareCard will be one of convenience. I know for me, one less piece of identification or card in my wallet is a good thing, but we do feel that it's a natural merriment between the two. We are going to be able to leverage identity proofing process, and so we can investigate fraud in our system, and I think that's an important but not the most important part of this process. As I said earlier, it's easier for health providers to ensure that they're providing the right services because of that photograph. We are going to be continually in a process from here on in British Columbia that you will re-enroll in MSP every 5 years. And that's an important place for us to check, to continue to check that we are delivering the services to the right people and those who are eligible to receive them.
I know we had a person coming back from Alberta using Alberta.
Burns Lake?
Yeah.
We've just joined. Could you please mute your sound? We've just switched over to you. Thank you.
So we also wanted to take some time to identify that we do envision as a government that there will be additional services eventually that come on stream. We don't have any of those services lined up, but in the future we do believe that as other government services come on board, they will be able to use this card and its enhanced security to ensure that you can access online services and in-person government services, and that they'll work with the appropriate card readers and computer systems that we have in the province. So it'll be a continual growth exercise for us, and as those programs come on board, we'll have public information about those, but they will be things along the lines of potentially elections, qualifying or confirming your ability to vote during elections. I'm trying to think of another option.
Students.
Yes, student identification, those kind of things. Access as a student to your education records, those types of things, government provided services. So one of the key tenets of making sure this transition is a successful one and that we move smoothly through the next 5 years of re-enrollment for the province in this process is ensuring that we have health stakeholders and our other stakeholders and health service providers, understanding what we're doing, how we're moving forward, and working through any potential issues that may come up. It's going to be an ongoing engagement through the transition and through the next number of years as we go through this process. We are looking to send out stakeholder engagement packages that are being prepared for electronic distribution in the next number of weeks. These will include things like an introductory overview letter, which will explain the basic tenets of the project, some fact sheets to be able to easily identify all the different elements of the card and what it looks like, so that as a health provider you'll be able to easily identify it, and a series of FAQs that we have been working on for a number of months to ensure that the most expected questions and concerns are addressed quite readily. We're also going to leverage the existing medical services plan website, which many health providers, I'm sure, are well aware of its presence. It's a natural place for health providers to come into the ministry and get information about MSP, and we'll use that information channel alongside an additional dedicated BC Services Card website to ensure that health providers and group plan administrators are kept up to speed with the changes as we move through. And in addition, we are developing a self-serve e-learning module that health sector stakeholders can access whenever convenient, and we can get a broad reach across the province informing everyone of our changes. So linking together health stakeholders and identifying the issues and challenges that we need to do in terms of change management strategies. It's key, and ensuring the First Nations populations, particularly rural, remote, are supported properly through this transition is very important to our whole project. Just recently, I think just last week, we had the initial meeting with Health Canada and First Nations Inuit Health and the BC region. And from there, we are looking to engage with the following agencies and authorities over the next number of weeks. So weeks and months, I suppose. And I won't read them off. Oh, I will read them off because I'm sure some of you on the phone can't see it. So First Nations Health Authority, the Health Authority Aboriginal Health Leads, First Nations Health Directors Association, First Nation Band Offices, First Nations Community Health Representatives, the First Nations Health Council, and the BC Association of Aboriginal Friendship Centres are those that we are currently targeting over the next number of months. We also will be doing some broad public awareness campaign. So this will come in the form of print and digital media, so newspaper ads, web information ads, and in some cases some targeted radio information campaigns, and those should start in early January. We'll also be making some print materials for the public to distribute to the health stakeholders, health authorities and providers, and other public spaces, so that we are ensuring that we can target a wide range of audience to understand the changes that are coming forward. And as I said, there's a new BC Services Card website that is currently live with general information about the changes that are coming, and will be updated on a continual basis as we move through this process. So that was a very rapid presentation and broad overview of the services card. The key part for us today was to ensure we could get as many of our First Nation stakeholders online to begin to have the dialogue about where we feel we may need to help your organizations, help you with your interactions with the BC citizens during the transition to the new services card, and get a good understanding of where you think we may want to target some of our questions and answers. And so I think it's important, prior to having a Q&A session here, that everybody's aware that the Services Card, BCServicesCard.ca website is a core piece of information that, a central place of information that we will be able to provide. You'll be able to garner a lot of your questions from. But we want you to have a direct line into the ministry too in terms of stakeholder engagement. And we'd encourage you to provide any of your questions or concerns to Megan Cleveland. So, and there's a dot missing in there, hey?
Oh, is there?
So it's megan.cleveland@gov.bc.ca, but we can circulate that email address and contact information through Crystal, I suppose.
Yep, she's nodding.
Okay, thanks, Crystal. So now we'd like to open it up. I do have my colleague Stephanie Powers here. As we mentioned, she's the Executive Director for the MSP Program. And between the two of us, we should be able to answer most of your questions. And those we can't, we will take away and get answers to you.
Good afternoon, everybody. I'm calling from Cowichan Hulkaminum Health.
Hi there.
Can you hear me?
Yes, we can. Thank you.
Okay. I have a question, and maybe it was mentioned and I just missed it. What consultation took place with First Nations and Canadians in general, or BC people in general, before this was implemented?
So it's Stephanie from the Medical Services Plan. So it hasn't been implemented yet, and that's what this stakeholder consultation is now. We are in the process of moving towards implementation in early 2013, and this is where we want your advice and your guidance on how to do outreach. We've had some preliminary discussions over the past year or so with different groups and different colleagues at different levels, but now we're at a point where we feel like we're able to come out to the communities and ask for their advice and guidance on how to move this ahead. So we haven't implemented yet. We'll have 5 years to complete the implementation, and so that's why we want to canvass you guys for your good ideas on how to reach out and get all of your members ready to go for when this transition happens. Nikki?
And I would just add, in addition, I think 2 years ago or a year and a half ago, there was some public polling done. This is not and it is as a result of having some scenarios come up where we know that the current CareCard that is existing in British Columbia has no longer met the needs in the time of where we are as a society in terms of security measures, in terms of assuring that there isn't fraudulent behavior or misuse of a CareCard, as well as providing greater access to services. So there was general polling done by Ipsos Reid, I think 18 months ago, and that began some of the discussions of how we would move this type of project forward.
I'm just wondering, could you let me know what First Nations were consulted in the initial process? You said you had talks in the last 18 months.
Yeah,
this
so
is new to me.
Yeah, this will be new to a lot of. This will be new to a lot of people, and so we've had some discussions, and I'm sorry I don't have all of the stakeholder lists in front of me, but I do know that we have canvassed different communications, different groups. We've had discussions with First Nations Health Authority, Grand Chief Doug Kelly and others are aware of this going on and the changes that are coming. So we haven't gotten down to the community levels, but certainly at the strategic and executive levels, we've been linking them in and looping them in.
Thank you.
It's Darlene Sharp speaking from Cowichan Tribes. This is very new to me as well, and I have a couple of questions. The one question is, I understand the rationale initially as to kind of why you want to do this and update the card. I'm not quite sure. There was a PowerPoint that said one of the rationale was to improve services to First Nations people. And does this mean that this is going to be a data gathering in a formal way to actually collect data to address the specific needs to First Nations communities and their specific needs? And will that data be used for all other people and not just First Nations?
So, sorry,
it was about halfway through the presentation.
We're looking madly to see where it is on the slide because we're not sure.
It's about halfway through. What was it under? It was following to improve convenience and misuse, last updated 1989. And you've got the Ministry of Citizen Services and Open Government, Health, BC Health, Ministry of Health, and ICBC. It was following that area.
I don't know.
Sorry, there was, so let's just approach the question, because there was no specific intended discussion about just delivery of service for First Nations. This is intended to be a province-wide shift for all provincial residents to move to what is going to be the better delivery of health services, as well as a more secure way of transactions with your health providers, and allowing us to ensure that we are providing the right care to those who are eligible in BC. And so,
so just to build on that a bit, Nikki, is one of the things that we've heard anecdotally is people share their care cards. And so while your cousin or your aunt or somebody might be visiting from a different province or from Washington State or something, and something happens, there's lots of anecdotal stories that they trip over the curb and break their ankle. Someone gives them a care card. The concern we have is from that is not just from a taxpayer perspective on paying for services. It also means that goes on your permanent health record. And so from now on, your permanent health record now says that on whatever date it was, you had a broken ankle, and that can impact other care. So if it's something as simple as a broken ankle, it may not. But we've had other people where, you can only have one gallbladder, appendix removed. Can't have two. And so from our perspective, from a health management and clinical perspective, having a photo and a more secure card just lets us protect your health record, because it's your health record and you have it forever. It just makes us be able to watch it and make sure that the people who are getting the service are indeed the person who holds the card. As for the data, Ellen, I don't think.
So as for the collection of data, the PHN, which is the personal health number, which is would be the same number you currently have printed on a care card that you have in your wallet now, will remain the same. Your health providers will continue to have access to health information related to your PHN, but that information will not be collected on this card, nor collected in a central database for this card. It continues to be collected through electronic health records as it does today. In addition, that health information will never be shared with other providers. So all we're doing here is allowing personal identification information, which is date of birth, your name, photograph, address, the information that's on the front of your driver's license, to be married to the PHN number, which is the same, attributed to the same name. So that's the connection that's being made by this data collection.
Okay, that's great. I understand the use for security. So we're affiliated with the Ministry of Health and ICBC, but when our care card is being used, that stays with the Ministry of Health.
Yes, absolutely.
And we'll never go to ICBC. Yeah, for sure.
The only information
I guess that's where I was confused.
Yeah, the only information updates that would ever be shared amongst the partners are change of address. So if you were to move, you would change your address for your driver's license. It in turn would tell us, Ministry of Health, that you have now moved. So that's really the only information.
It's not just our health information that would not be shared. Also, your driving record is not shared back with health.
Yeah.
So both are separate and distinct.
Hi, Songhees has a question.
Hi, Songhees.
Hi. Hi, Stephanie. It's Lorna Hillman. I'm the Director of Health at Songhees. Yeah. Just last week, I was at the First Nations Health Directors Association AGM, and Grand Chief Doug Kelly was there. This was brought up. And I'm sure you're going to hear about this from the First Nations Health Authority and Health Council. But the whole thing about linking the status card number to the MSP around, sort of that in a large part would improve access for status card holders to services, and also clear up billing stuff with non-insured health that will come under the jurisdiction of the First Nations Health Authority. So I'm just wondering around, what is the ministry's thinking around that so far in those discussions?
So I think I'll speak a little bit to it, Lorna, and it's nice to see you, and then I'll let Nikki talk to the other piece. So yeah, we're well aware, and we work very working very closely with Grand Chief Doug Kelly and the First Nations Health Authority on the transition that's coming up and happening, because there are some issues around the medical services plan and primary care and some of the other pieces. So we're in constant dialogue and constant talking about that as a ministry as a whole. And so we're well aware of those issues as they come on. I know at some point in time that we did discuss the idea of linking those or doing some sort of linkage. And I think just given the circumstances and the timing, it had to be put off. Nikki can probably speak to it more to know where we are now, but it was something that was considered and thought about doing. And just because of the nature of trying to drive to get it out the door, we put it off to the side and parked it for now, but Nikki might be able to tell you.
Well, so thanks for the question. I have already begun doing some work with the First Nations Health Authority, and Joseph and I met, I think, only in the last 10 days to 2 weeks, with Labour Citizen Services as well, because there are probably a number of different avenues in which we can strategically look at trying to assist bringing that sort of data information in and utilizing the BC Services Card and our cyclical approach to making sure we touch bases with everybody across the province over the next 5 years. It's not a window of opportunity that I think the First Nation Health Authority wants to miss, nor do we, but it will be a sort of partnership approach of how best to do that using the respective instruments we have in play. And so we will have more to, it is not being ignored, and we'll probably have more to report on that in the next number of months.
Just need some clarification from, oh, sorry, go ahead.
Hi everybody, I'm Catherine Berry. I'm the program assistant for the UBC Learning Circle. And we actually have about 11 people joining us right now by Adobe Connect, so they're at home or at school or at work with their personal computers. And I just have a question from Doreen, and she's asking about information dissemination. So her question is, in regards to rural areas, can somebody travel to do information sessions? So I'm assuming she's referring to somebody from the Ministry of Health being able to travel out to communities and do some information sessions about the CareCard as well.
So how I would love to do a road trip around the whole province. It isn't something we are going to be able to go and have somebody physically in all communities doing information sessions, but we are looking at a number of different ways to ensure we can provide the right educational materials and information sessions, probably through, as I mentioned, an e-learning module that anybody can go in and have at their own time and convenience can go in and take, as well as print materials that we can widely distribute, and different avenues for us ensuring that those on the ground, particularly in rural remote communities, are not going to be hit unaware of what the changes are coming. So no, we won't be sending people everywhere, but we will do everything we can to ensure that we're spreading as much information as possible. And I would encourage those in rural remote communities who've had previous scenarios that have worked really well to suggest to us any ideas that we could leverage. We'd be more than willing to take on some of those ideas and see if we can make them work here too.
My sense is just to add up to that, is once we start going out with some of the public information, that will spread and people will have more information, and then we'll get more uptake, whether it be through 1-800 numbers or really we're hoping through the website. And so we're hoping that that will be enough, and we're also hoping that if we provide the right information to the physicians and the nurse practitioners and the people who are in the community, the pharmacists, to help them get ready, that they'll be able to do a lot of the information dissemination for us.
And the last point I just want to add to Stephanie is that because we're leveraging our relationship with ICBC and the government agent office's front counter, in all communities that have a government agent front counter, they will be the ones who will have a lot of information on hand, as well as will be the main point of contact to going into getting your new services card. So there should be a touch point in most communities, or in many communities, which is a familiar place that you would go for other government information.
Just a quick question from Cowichan. Is there any personal medical history or information contained on these cards?
Nothing. Absolutely nothing. And one of our biggest challenges, I think, will be ensuring that everybody understands and is comfortable with the idea of having a card with a chip in it. That chip contains no information in it. It is literally almost like your pass and go card at a gas station that would just allow you to access information, but you control that. The only information that's held in the mag strip, which is the black line across the back, is the exact same information that's on the front of the card. So your printed name, address, date of birth,
PHN.
And PHN.
But no.
Okay. And last question from me and Cowichan.
No, there may be more.
There's no GPS tracking system in this card, eh?
No, not yet.
No, absolutely not. No, that would
not yet. That doesn't leave me feeling warm and cozy.
I was completely
Big
kidding.
Brother's watching.
So you can chalk that up to the rock and the moccasins. Really, there is nothing like that. We have had to do a lot of consultation with the OIPC, which is the Office of Information and Privacy Commissioner, because as you can imagine, we have to make sure that we are respecting the privacy needs of all British Columbian citizens. And so we can absolutely assure you that there is no hidden GPS or anything like that. And the OIPC has been, the Office of the Privacy Information Commissioner has been fully apprised of where we're intending to go, and we have to stick to the appropriate channels for sharing information. And has asked some tough questions about it. Yeah. That was one of their number one concerns. Yeah.
Darlene from Cowichan. We're not done yet, Helen.
No, we're not.
That's okay.
The questions I have is there is information available through your website and whatever, but the reality is that the people who are most at risk here are people in poverty, and they don't always have access to these services. Just a point that I want to make. And the other question that I do have is there a fee for these cards, or an increased fee through BC ID, which a lot of the people those who are living in poverty don't, it's an issue. Is there going to be a fee for these cards?
I'll tackle the fee question first and then come back to vulnerable populations. So no, there is no additional fee. If you renew your driver's license today, there is currently a $75 fee to renew your driver's license. That fee will still be in place for a driver's license, but we're not adding a cent on top of that to include your services card. The same with the BC ID. I believe it's a $35 charge every 5 years. Whatever the current BC ID charge is, that is over 5 years, not a cent will be added to that. For your CareCard will just be included in its portion of that. It was really important. You currently do not pay for a CareCard. We are not adding any other fees on top of this to increase revenue or to add any burden to citizens. So it's the exact same fee structure that exists today in the identification side There was no fee to MSP cards, and we're not including any additions. In terms of vulnerable populations, I really appreciate that question. We are very well aware that there are a number of areas and populations that we need to take a focused approach on how we're going to address the delivery of a services card to those specific populations. We haven't finished all the work on that, and we want to do it in a respectful way over the next number of years. What you'll note back on one of our previous slides, we talked about our current target areas as we launch this card. That is for newborns, those who are new to the province, and those people who are currently driving between the ages of 19 and 74. We are purposefully targeting that group because that will be the vast majority of the population. And as we go through this process, we will continue to work on what we need to do better to ensure that we can help with populations that might have some barriers to this card.
Yeah, I just add that that is absolutely something that's been on our radar right from the get-go on how do we do this. Healthcare, as everybody knows, the Medicare Protection Act says that MSP is mandatory and you must have it. So the last thing we want to do is affect the vulnerable populations, many of whom need the medical interventions, and so we don't want them to feel like they're being marginalized and kicked off of MSP if they have trouble with re-enrolling and have trouble with documents. So we are well aware that has been one of our very top goals. We've been in contact with, just preliminarily, with Social Development, the Ministry of Social Development, the Ministry for Children and Families, and other organizations to start thinking about how it is that we can go out and help this population re-enroll, because it would be great for them to have a piece of ID that they could use for other services, while making sure that we're not putting them in such a circumstance that they can't qualify for that re-enrollment process.
Thank you.
I've got another question here. It's Catherine from the UBC Learning Circle again, and it's about losing your MSP card. So this question is from Shannon. If you lose your MSP card before your driver's license expires, do you have to pay the whole driver's license fee when you get the BC Services card?
So I would just come back to what Nikki said. There will be no cost for your the health portion of your BC Services card. The only cost is what exists today when you renew your driver's license. If you choose to combine your card with your driver's license, there will be a cost to renew. If you lose it, I think it's like $20 or something to replace your lost card. If you have a standalone card, there will be no cost, because we have determined that for health purposes, we can't have that barrier that people can't afford to get a new card.
Okay, thank you.
Can you explain that again? It's Darlene. I wasn't quite sure, because that's if you have a driver's license.
Right.
And I'm still not sure if I heard the right answer. I mean, it's a combined card at this point, right?
Right.
I've lost my combined driver's license card.
Right.
And my CareCard.
Right. If you've lost your combined driver's license CareCard and you need a replacement, it would be as it is today. You would go to the ICBC counter and they would charge you whatever the replacement fee is for your replacement driver's license.
$35 to replace your driver's license.
There will be no cost for
replacing
the card. So if you have it combined, then of course you'll have to pay the ICBC replacement fee, because that exists today. It will exist tomorrow. If you have a standalone card and you lose it, just as you would with your CareCard today, you can apply and get a new one with no charge.
So just be clear, just for me to provide one more piece of clarification. The reason you would pay $35 if you have a combined card is because you need a driver's license. It's not because the combined card is the only one we charge, is going to be charged for. If you lost your BCID card, you'd need to pay whatever replacement charge it is to carry on to having a BCID. But there's no additional cost for the CareCard, new services card portion. If you lose both of them in one because it's combined, you could choose to combine them again. You're going to pay $75 or $35 to replace your driver's license. If you can choose not to combine them, you still have to pay $35 to get a new driver's license, and an additional card for CareCard would be free.
Hi, it's Seabird. Do we have a question?
Okay.
What about if someone loses their combined card? What ID are they to use? Because you usually need 2 pieces of ID to get your ID replaced. So if they're all combined onto one one card, what picture?
It'll be the same as it is today, and I actually don't know the list of acceptable ID that ICBC has, but they have a list on their website which indicates if you've lost your driver's license, what other secondary pieces of ID would be, and there's a number of them. I know passport is one of them, birth certificate is one of them, I think some school government-issued school identification is one. There's a series of them, so you would be able to use a combination of those.
Yeah, your status card for sure.
Status card.
And that's not different than if it was today.
Yeah.
What they are going to ask for if you lose it, you need to replace it. Is what's on their website today is what will be there after we launch.
On the flip side of that question, actually, is an interesting point about the ability to, when you've combined your CareCard and your driver's license into one, it actually becomes a much higher level of identification for access to services. And so what we will be looking to our other partners in government over the next number of months is for them to revisit policies that may currently require you to have 2 pieces of ID. If you come in with a combined services card, that will be accepted as 2 pieces of ID because it's that much higher level of security behind it. And so it would minimize some of the ask on citizens for continually having to provide 2 pieces of identification.
Hello, it's Crystal. Hi. Okay, we have a second part to Kelly's question. And what do you do in the meantime for the CareCard if the CareCard is lost? And her other part to the question is, so you have a choice to combine the driver's license or not?
Yes.
The answer is yes.
So on the combined card, you do have a choice. For a convenience factor, we think it's probably most useful for people to combine the 2 cards together. As I mentioned previously, it becomes a higher level of identification to allow you access. It becomes one less card in your wallet, and it means that you only have to, on a 5-year cycle, you'll do one action to renew both cards at once. However, if you choose to have a driver's license and a services card, that is completely appropriate as well. It's a choice you would make when you go in to renew. Regardless, every citizen in BC will have to come in over the next 5 years and re-enroll into MSP and become on a cycle. So that every 5 years from there on in, you will have to go through a re-enrollment event. And
the first part was?
And then the first part was?
Crystal, the first.
Oh, MSP.
Yeah.
What happens if you lose your card? So Stephanie can talk about this more eloquently than I.
Well, so, today, if you lose your CareCard, you can just put a phone call in and a replacement card will be sent to you. In the future, once we launch, come the new year, you will be asked to go to the counter and have your re-enrollment, the cycle start then. So that will be the required. There'll be no cost, but we will actually ask you to come in and do your re-enrollment process at that point.
And then I think the other part that's really key is at no time, if you lose your CareCard or you lose your new BC Services card, will you be denied service in BC? So emergency services. Yes. I think that's.
Can you repeat that? People are being denied services at ER if they do not have any ID?
No. You would never. That's the opposite.
That was exactly what we just said. If something happens and you do not re-enroll, or if you've lost your card, in an emergency service, you will be taken care of.
Always.
That is not, because that, again, that's not the purpose of this. is to kick people off MSP. The purpose is to have people re-enroll and go through a process. But if there is an accident or if something happens and you're taken to the emergency room in a hospital, you will get care. You don't have to worry.
Well, thank you. I am in nursing, so that's always been the policy, so I just misheard. Thank you.
This changes
you.
none of those policies.
The last thing we want is nurses in an emergency situation and doctors to be starting to look for your services card before they treat you. We're going to let them treat you first, and then we'll send you a letter saying, get into the counter. Anybody else?
First Nation Inuit Health. I came in late, so somebody mentioned First Nation status cards. That we will have the availability to go onto this card too?
Not at the moment. No, that was the discussion, and it's certainly that's something that, from a project perspective, we're aware of, that people would like to be able to onboard that service. We're not ready for that yet, but Nikki is working with the First Nations Health Authority to work out how and when and if that could happen.
Okay, thank you.
You're welcome.
Is there any other telephone questions?
Is the website up and running yet?
Yes, it is. It is up and running now. It has the general tenets of what the intention of the project is, and some information about where it's going. It also has some examples of the card pictures on there, and it will continually be updated in the new year as we go live with this project. So it's a good resource for everybody to be aware of and to revisit on a regular basis as needed, as you feel you need to, because it will be continually augmented.
Are there any other questions from any of their other participating sites?
Hello. My name is Larry Thomas. I was wondering about that newborn BC service card. Do they have their own when the babies are born, or is it under the parents? And
so newborns will receive their own card like they do today, and it will be a non-photo card. It'll be, it'll be the third example we had, which was of the non-photo cards, and it will be issued as they are today to the newborn themselves with an independent PHN, and that healthcare number will remain that child's number throughout their life.
Yeah. So what happens today is usually after a baby is born, there's a bunch of forms that you fill out and send to Vital Statistics. And today what happens is Vital Statistics triggers over, they issue a card. That will continue. So it'll be the new card. It'll be a non-photo. We're not going to make newborns come into the ICBC counter and get pictures taken. So it'll be a non-photo card, and that card will be good for them, we think, well, until their 19th birthday, till they're required to come in. So that will be the card that they get, and so we're not expecting any changes in the system, that once the card is issued, they'll have it and carry on.
Okay, I'm just giving enough opportunity here. Is there any other further questions?
Actually, Crystal, there's one for Doreen. I think I might have talked about. It was just about kids. If you have 2 or 3 children, do they continue to have their own care card?
Yes.
Okay.
So what we're planning on doing is that because we're not requiring the children, so for us, we're trying to look at it as a stepped approach. We have 4.5 million people in BC to re-enroll, and the last thing we want to have happen is what happened with passports, where there were lineups around the door. So we're trying to take a staged approach on who has to come in the door, which is why, as Nikki said, we're focusing first on the drivers because they're coming to the counter anyway, people new to BC because they have to enroll anyway, newborns because we give them their PHN anyway. And so what we're hoping is, in the meantime, the people who have children now who have care cards, their care cards will continue to be good. Hopefully they don't lose them. If you have a son like mine, I think I'm on my 3rd or 4th of the year. So hopefully they keep them until they're 19. And then at that point in time, then they'll come to the counter and they'll go through the upgraded process. That's the intent and that's the hope.
Okay, I'm sorry. There was one last question from our Adobe audience. And what happens if the driver's license is revoked?
We've tossed around that one. That's an interesting one. So if the driver's license is revoked, I guess it's personal choice. If it's revoked for 24 or 48 hours, you may want to risk it and wait till you get it back. If your driver's license is revoked for a longer period of time, you may wish to attend the counter and get a standalone card at the ICBC counter to get one. So that will become a personal choice, knowing that if you don't have a services card, and if you're going to a walk-in clinic or something, they may ask you to pay out of pocket. Not for emergency care again, but if it's just regular, you got an earache or strep throat or something, you may have to pay out of pocket. But if it's for 24, 48, 72 hours, you may just want to risk it and say, I'll just wait until I get my driver's license back.
Okay, it looks like we're running short of time here. We're coming to an end. Is there any final questions out there on the video conference? I do have a couple questions here and a couple of comments to make. So is there any of the other video conference sites that have questions or on the telephone? Okay, so there has been the question about the PowerPoint presentation. People would like to have a copy of that to be able to circulate that or discuss it probably with their leadership or their frontline workers. What is your response to that?
So I think it's an appropriate avenue to be able to share around. I just would ask that we probably need 10 days. We're just going through a finalization of one last approval, and then if we can get that to you, Crystal, and you can disseminate, that would be great.
Okay, now that I do have one suggestion leading up to that. Now, in hopes to build these bridges and still be that tool of change here at the UBC Learning Circle, a couple of suggestions maybe, and if we could receive some feedback, because we do have some of the frontline workers sitting currently with us. Now, one is the resource base that you're talking about building upon, and the website and the FAQ, and the next steps, and using this as a partnership approach to build these bridges. Now, I'm just wondering if we could be the tool of change to further reach out to communities, not individually. I'm talking more on the basis of maybe I believe the number is 24 hubs across the province, which would reach pretty much almost 80 to 90% of the First Nations communities, and doing a presentation at that level, because a PowerPoint without the presentation is people will still have those same questions. So that's just one opportunity I see moving forward with this initiative, and also having linkages on the First Nations Health Authority website, in addition to the UBC Learning Circle website, that we make those linkages happen. And if that's the process we're willing to move forward with as our next steps.
So I like all those ideas. I think they're fantastic, Crystal. Thank you. We are in the midst of finalizing what we call web buttons, tiny little buttons that can be put on anybody's website to quickly get redirect people to our BC Services BC Services website. So we can easily provide those to the UBC Learning Center, and as well, I think it's a very wise idea for us to approach First Nations Health Authority to put one there as well. You asked a bit about the collateral materials, the FAQ pieces, and the information sheets and ID sheets that we're creating. They will be ready in early December, and this group is definitely one of the groups we're targeting to get them to quite quickly. So that will be an extra resource tool. And the last point was about whether or not we could extend the presentation beyond to the 24, I think you said, hubs. And absolutely, I'd just like clarification, Crystal. Are you looking to do that on our behalf, or have us do it to those groups?
Sorry, just we become the tool of very much like this, where you are the presenters and we just connect into those hubs.
We'd be more than happy to do that in any occasion that you think is appropriate. That's going to be of value. We are more than willing to make ourselves available to do so. So thank you.
Okay, thank you. Because the other suggestion is trying to do it by region, host regional sessions. I mean, I'm not sure what the feedback would be, if there was any feedback on that from any of the communities.
So, Crystal, we'll really defer to
What about you?
Oh, sorry, I was just going to say.
Hello.
Hi, Lorna.
Hi. Sorry, just around the regional question, I guess the only complication would be for the north, because it's such a huge region, and the communities are so far spread apart. So that was my only response on that one. But the hubs are a good idea to work through, and also the Intertribal Health Authority, who works with a lot of us as well, is a good vehicle to use.
Mm-hmm. Yeah, so we're madly writing notes, Lorna, to make sure we get all of these in, because this is exactly, we're hoping to, we want to do as much outreach as we possibly can within our restrictions, and so any of those sorts of ideas of how to reach people is exactly what we want.
Okay.
The tribal councils are good too, like New Channel Tribal Council.
Right.
How about using this genre as well? Like we have, well, you can see the office here. If we could use, like, have this presented to the community members that are interested to come in.
Yes, well, I think we're willing and capable of doing video conferences, and we can make ourselves available, because again, that's how we're getting the information out. Mm-hmm. So we'd be happy to do that.
And the other thing being YouTube.
YouTube.
Yes.
Tossed around that, which is interesting.
Yeah, there will be a informational YouTube video that people can watch. I think you'll find that the e-learning module and some of the information campaign materials and FAQs probably add a little bit more of the level of questions or answers that people are generally looking for. But we are trying to target many different avenues to ensure we can speak at various levels about the change that's coming. So, absolutely.
No, good ideas.
So, Crystal, I think we'll ask that Michelle and you continue to work together to look at all these avenues to see how best we can broaden our scope and reach into the First Nations communities. And we also will tweak today's presentation a little bit, because I recognize there are some areas we probably should have paid a bit more attention to and have some upfront answers that are relevant and would alleviate probably some of the questions or concerns that we heard raised today. So we will take that feedback.
Thank you. Thank you for your presentation today, and thank you for finalizing that PowerPoint that we will circulate out to the communities, and definitely the linkages and the bridges that we're building and moving forward together to help in the transition, because there seems to be so many changes with the First Nations Health Authority, and this is a change upon that change, that we're all working together to try and make this a smooth transition over the next year to 6 years for the First Nations communities in the province of BC. So is there any final thoughts or any final comments? If I could have the Provincial Health Service Authority just stay online just for a couple minutes after people start to exit.
No problem. The only thing I would say also is that when we circulate out the PowerPoint, we will give clear indication of where you can direct some questions and comments to that may come up in the next next while. And this project is being done by the Ministry of Health, not the Provincial Health Authority, just so everybody's aware.
Yes.
Hi, it's Vanessa from Seabird.
Vanessa?
Hello?
Yes, go ahead.
I was just wondering if there would be an option for a person to apply for a combined card as well as a CareCard in the case that they did get their driver's license suspended?
One card per person at a time. And there is an exception to that, and that's if for sometimes children need 2 cards, but for adults it's 1 card per person. We did think about that too. People who are planning to get their driver's license taken away may want to just go for the straight up standalone card.
I don't think people are.
Thank you, Seabird, for that question. Okay, as we're wrapping things up here, I just want to just remind people if they could be visiting our UBC Learning Circle. It seems like an exciting place to visit. We do have our youth circle sessions up and coming, and of course our challenges are still we need to reach those targeted audience, which is our youth workers and the school districts, and tying them into our youth circle, because we do have a couple youth circles coming up. We have Elisa Derrick, who's a SFU student. We have on November 22nd, and we have November 29th, William Bellew, the actor. And we have sessions definitely for our next sessions here for the UBC Learning Circle on depression and suicide with William Morris off Vancouver Island and Susan Armstrong from Prince George, and promotion of our Aboriginal Health e-mentoring project with UBC, and then again back to the youth circle on December 12th. So there's some exciting initiatives up and coming, really building on our youth and strengthening our youth. So at this point in time, I'd like to thank you for all participating, and enjoy the rest of your week. And I look forward to working with all of you. And if you have any questions, please send me an email and any future ideas for the UBC Learning Circle. So thank you all again for participating, and I look forward to seeing you again next time.
Thank you very much.
Thank you.
Thanks, everyone.